Hi everyone, it's Dr. Jhawar with Revive MD Direct Primary Care. May is Mental Health Awareness Month, and as a primary care doctor, I see many patients with different mental health conditions like anxiety, for example. I thought it would be important to talk a little bit about what happens in our brain when we're anxious and a little bit about neurotransmitters. So we have neurotransmitters in our brain that help with signaling between neurons or our brain cells. And one of those neurotransmitters is serotonin. Serotonin is quite important because when we have fluctuations in our serotonin levels, we can become very anxious or depressed. When our serotonin levels are really low, we do get a lot more anxiety and depression and mood changes. So how do we keep our serotonin levels up, or how do we boost them if they are low? There's many different ways. For example, lifestyle modifications like getting a lot of exercise and movement in every day will really help because it'll get your heart rate up, and that'll also help with changing your circulation through your brain, and that can help boost your serotonin. Things like getting adequate amounts of sleep, that can also help with keeping your serotonin levels up. Limiting alcohol intake and caffeine intake, because energy drinks, excess caffeine and alcohol, they can actually alter the chemistry of neurotransmitters like serotonin, and they can cause the levels to actually go down. Limiting those kinds of beverages can also help keep your serotonin up. And then, of course, things like, meditation or breathing exercises. These can have a very calming effect, and they can help like regulate your heart rate. And that can also keep your serotonin levels up. Now, if you're doing all of these things and you're still really struggling with your anxiety or depression, then, a primary care doctor like myself might recommend trying a medication, something like an SSRI, which are selective serotonin reuptake inhibitors. And what these medications do is that they actually help with increasing the amount of circulating serotonin in your brain. And so that's quite important and very helpful. Many patients find that it can really help with not just reducing that sort of anxiety feeling or panic attacks, but it can really help elevate mood as well. Now, I just want to make you all aware that, SSRIs or these type of medications, they are not addictive, but they do take some time to build up in your system. So they, take a little bit of time for them to work, but, sometimes they can work really well even with lifestyle modifications. So I hope this explains a little bit more about, serotonin and why it's important in our bodies. I'll be back with more videos.